Hi, my name is Barb Grover, and I'm a small business owner here in Portland, Oregon. So the story begins maybe back 5 years ago when I was working at another employer who provided insurance for me. And when I was laid off, I went on to Cobra and had a plan through that. Took another job, got insurance again, got laid up, or cut my hours back as we started this business, and I lost my insurance, so I again went on Cobra. When that expired, I started shopping around for health plans and found that I had a very difficult time getting plans. Both it was a hassle. I would fill out these very, very long forms with my complete medical history, and then I would get denied. I was given reasons of pre-existing conditions, or it wasn't officially a denial, but oh no, you don't qualify for that plan. But then they wouldn't be able to tell me, oh, what plan can I apply for and qualify for? So it was really a headache, and I became very frustrated. So finally, I basically took what was, I believe, called a conversion plan. It was the plan offered by the company that was providing my Cobra payment, and it's what they were required to offer to me as a expiring Cobra recipient. So I took one of the options that they offered, which was a little more expensive than I could have budgeted at the time, but it was my only option as I felt. And so I had that insurance right up to the time where I applied for the Cover Oregon Affordable Health Care options. I found that experience to be, initially frustrating because I got one of those letters that your insurance is no longer available from my previous carrier. And so, another wave of panic set in. Oh my gosh, I have to shop again and do all this. But what I found was, even though the Cover Oregon site wasn't operating online, I got the form in, and in a reasonable amount of time, I got notification that I could go ahead and enroll in a plan. And so for me, it worked out that I was enrolled by January 1st. So I ended up with a plan that both my husband and I selected that fit our budget. His plan was fairly inexpensive, about $170 a month. His premium and mine combined were, still about $70 less than what we ended up choosing through the Cover Oregon options, but we were able to choose options that gave us a lot more control over what our deductible was, what our household cap was in spending for the year, and we were able to choose options such as $25 office co-pays and $25 prescription co-pays that really made a difference for the way we needed healthcare to take care of us. And so in the long term, even though we paid about $70 more out of pocket combined each month, we've actually been paying less because our prescription and doctor visit rates are a lot more affordable. So I got insurance on January 1st, and on January 6th I was diagnosed with stage 3 breast cancer. And it was really startling to me to have that happen, in part because it was a huge relief. I thought, wow, just 6 days ago, I don't know how this diagnosis would have affected my ability to retain my insurance at the rate I was getting, or retain it at all. It was a major pre-existing condition that would make shopping for another policy probably a nightmare, if not impossible. I was, in a way, really relieved to know that through the Affordable Care Act and the Cover Oregon plan that I'd selected, that I had assurance that I would have coverage. I knew that I was going to have a lot of bills. The plan isn't perfect. I still have to pay a lot of money out of pocket. This isn't going to be an inexpensive treatment course for me, and so, there's no big vacation this year, no large expenses, monthly budget's still going to be tight, but we know what to expect. And that is something that gives me a great deal of peace of mind. Also gives me a lot of peace of mind knowing that, I'm not going to get dropped, and I'm not going to have my premium raised now that I have this expensive prospect of treatment in front of me. So a few months have gone by, and I've been doing my treatments, and I've been really happy with the insurance coverage. I've had lots and lots of doctor visits, and rather than paying 40% of each office visit, I'm paying only $25. And again, that's kept things really within my budget and really affordable for me, and it's made a difference. I mean, the last thing I need right now is to be stressed about money. It's going to happen. Like I say, we don't feel like everything's perfect with where healthcare is. There's a lot of room for improvement, no question, but I feel like this is a really big step in the right direction. It's important that we raise our voices and talk about the positive experience we've had, acknowledging again that it's not perfect, but it's a really good first step.